Hello guys, in this video we're going to be talking about the knee joint. So let's start with the knee joint. The knee joint is a synovial joint and it's modified as the hinge joint, hinge type of synovial joint. Its articular surfaces, as you can see in this picture, first we have this bone, the patella, or it's called the kneecap, and here we have the femur. So this blue surface that you see over here is the patellar surface of the femur. So this is where the patella articulates with the femur, and here this bone down here we have the tibia, and this thing over here that you can see, something has come out of the bone, something this is called the tibial tuberosity. So these are the main articulating surfaces of the knee joint, and femur, patella and tibia. So these are the major bones of that articulate for in the knee joint. Now let's talk about the stability factors of the knee joint. Every joint in human body has two major types of stability factors: dynamic and static. Dynamic factors are the factors that make the joint move. These ones are majorly muscles that surround the joint, and we're not going to be talking about this in this specific video. We are going to focus on the static factors, static stability factors of the knee joint, which are majorly ligaments and also some menisci that we're going to be dealing with. So let's start with the ligaments. In this picture, right over here, the first one, this yellow one, is the patella ligament. The patella ligament is the most anterior ligament of the knee joint, and it's a continuation of the tendon of rectus femoris, and it attaches on the tibial tuberosity. And right over here, these two green ones, so we have medial and lateral collateral ligaments, or this green over here on the medial side is also called the tibial collateral ligament, and on the lateral side that attaches with the on the fibia, we call it the fibular collateral ligament or the lateral collateral ligament. Then one of the major things in the stability factors of the knee joint is this, the joint capsule or the articular capsule of the knee joint. So this white thing over here. So normally the capsule of the joints we have in the shoulder joint or in the knee joint or some other joint, those are the capsule, those are kind of ligaments that surround the joint. They surround the joint completely to make it stabilized, and this is the capsule of the knee joint. Now if we remove this femur, and let's have a look from the superior view right here. So there are two other ligaments, this one the posterior cruciate ligament, and this one the anterior cruciate ligament. So the posterior cruciate ligament is coming from the posterior side of the tibia and is attaching on the anterior side of the femur, and the anterior is the opposite, it's coming from the anterior side of the tibia and it's attaching on the posterior surface of the femur. So the main functions of these ligaments, the anterior cruciate ligament and the posterior cruciate ligaments, is to stabilize the joint and the tibia and femur in the way that they don't slide over each other, so that femur doesn't go anteriorly, doesn't slide anteriorly and doesn't slide posteriorly over the tibia. So these are the main functions of these ligaments. And then again, from a superior view, there are two other main stability factors of the knee joint. The menisci. We have the medial meniscus and the lateral meniscus. So on this side, on the side of the tibia, this one is the medial meniscus, and on the other side is the lateral meniscus. And the main function of these menisci are to deepen the joint. They're on the surface of the tibia, the proximal surface of the tibia, and they make the joint deeper so the femur can come inside, and it prevents the dislocation of this joint. So these are the main static factors of the knee joint.